Good afternoon, students. Welcome in HCP lecture. Today I will start the remaining part of chapter number 9. Chapter is Hospital Formulary System from part 1 Hospital Pharmacy. In previous lecture, we have studied the definition, introduction, important terms for understanding the basic nomenclature of the hospital formulary and organization. Now I will revise the in short this again. First is definition. In definition is hospital formulary can be defined as an important document of hospital containing a collective list of the drugs. This system is a powerful tool for improving the quality and controlling the cost of the drug therapy. Then introduction. In that, formulary means a collection of receipts. Then these are the different selected preparations formularies available, such as general use formularies, for example British National Formulary, that is BNF, then Indian National Formulary, etc. Then hospital formulary is to be revised periodically and should reflect the current aspects of the clinical judgment of the medical staff. Then the hospital formulary system is the term used to indicate the way in which a hospital formulary is developed. Then next point is important terms for the understanding the basic nomenclatures of the hospital formulary. In that, first is generic name or generic terminology, then INN, then chemical names, active ingredients and brand name. First is the generic name. And second, IN is the abbreviation for the international non-proprietary name, that is generic name. Then chemical names, it is the description of the chemical structure of the drugs or medicine and serves as the complete identification of the compound. Then active ingredients, it is the chemical components responsible for the claimed therapeutic effect of the pharmaceutical products. Then last is the brand name, it is the proprietary name given by the manufacturer to distinguish its products from the competitors. Then last point we have studied in last lecture, organization. In that, hospital formulary consists of the three parts. First is part 1, then part 2 and part 3. Part 1, it gives the information on the hospital policies and procedures concerned drugs. Then part 2 is the drug product listing, and part 3 special information. And part 4 includes the following items. First is categories of the drugs, for example formulary, non-formulary, and evaluation and investigational. Then brief description of the pharmacy and prescribing, dispensing and administration of drugs. Then pharmacy operating procedures and information on using the formulary. In second part includes the drugs products listing is the main body of the formulary. First is item entries, then indexes to the drug product listing. Okay, each formulary items will have a descriptive entry. The entry will vary in length and content depending on the extent to which the provision of information and advice is considered necessary or desirable. Okay, these are the organization. In third part is an extremely useful set of the heterogeneous information on the medicines, for example dosage in renal failure, then antidotes, tablets of the sodium and potassium contents, important drug interaction, etc. Then a format and appearance of the formulary is selected as per the suitability of the hospital. The size of the formulary should be easy to carry. Pocket size is preferred, and copies of the formulary should be made available at each patient care unit, emergency rooms, and be given to all members of the medical staff. Then in that, a simple page from the typical hospital formulary: acetyl salicylic acid, that is aspirin, non-opioid analgesic and antipyretics. In that, aspirin is used for the pain, fever, prevention of stroke, then myocardial infarction, inflammation. The principal adverse effect of aspirin are gastrointestinal. Because of the risk of Ray's syndrome, it is used to the very limited extent in children. Then in that description, indications, contraindications, preparations, trade names, dose and use, storage, and last is a precaution. These all points are studied in we have studied in last lecture. Now see the today's point, that is selection, addition and deletion. In that in the preparations of the hospital formulary is the generally important to decide the first the range of indications which are to be covered. Then formularies are prepared taking into consideration the working of the hospital. P&T committee, after collecting advisory inputs from all professional staff of the hospital, decides the policy regarding selection of drug products in the formulary. Then following factors affect selection of the drugs for inclusion in the formulary. First is efficacy, side effects and contraindications of the drugs. Second, chances of interactions of the drugs. Then pharmacokinetics, patient acceptability, for example appearance, taste and ease of the administration. Then availability of the formulations, then uses pattern and cost. These are the factors affect selection of drug for inclusion in the formulary. First is efficacy, second side effects and contraindications of the drugs, second chance of interactions of the drug, then pharmacokinetics, patient, next is patient acceptability, for example appearance, taste and ease of the administration. Then availability of the formulations, uses patterns and cost. Okay, then the cost effective rational prescribing is the aim of the formulary. The cost effective prescribing involves the use of the drugs which the lowest cost, which is also effective, has minimal toxicity and it is acceptable to the patient. Then in that the cost effective rational prescribed in the aim of formulary. Then many formularies do not include the combination products, then arguing that a combination product includes the two or more drugs in a fixed ratio, it is impossible to increase the dose of the one drug without increasing the dose of the other. Then if a new product is introduced or new uses are found for currently marketed products, then these products may be considered. For additional of new products, request should come from the medical and pharmacy staff that are likely to use it. Then request from other hospital personnel such as nurses should be referred to the concerned physician or pharmacist. Then it becomes a part of P&T committee record. The secretary of P&T committee has to resolve if there is any questions before the committee takes decision on addition of the drugs in the formulary. Then deletion of the drugs product from the formulary may occur due to the following reasons. First is it is no longer available from the manufacturer. Then it is second, it is no longer being used, and third is it should not longer be used. The deletion drug product from the formulary may occur due to the following reason. First is it is no longer available from the manufacturer, then it is no longer being used and it should no longer be used. Then in that the third reason must be opted for deletion in case where new drug added to the formulary may replace old drugs, or it is beneficial to delete some products due to the controversial opinions, etc. Then drug deletion should be prime objective when the formularies are revived. Then in addition to mouth additions and deletions, in addition to mouth addition or deletion, it is necessary to perform periodic reviews of the all products in each therapeutic committee or a subcommittee for this purpose. Okay, these are all about the selection, addition and deletion. Okay, now I will stop here. Remaining part we will see in next lecture. Thank you.